Hey, Dr. Findlay here with Elite Chiropractic. So today I wanted to cover something that you may not have heard of, and that's called dermatomes. So what dermatomes are, it's just the area on your skin, the sensory area, where a single spinal nerve travels to and where you may be getting numbness, tingling, shooting pains, etc. So each spinal nerve goes to a different area. So I wanted to cover some of these today. So starting with C2, so C2, the second vertebra on your neck, goes up to the base of the skull, wraps around up to the top of the head. If we then go to C3, so C3 just stays right in the neck as well. C4 does the same thing, and then C5 is when we start seeing it to branch out a little bit. So C5 then goes around the neck and into the shoulders, down partway through to the lower part of the arm. C6 goes all the way down the outside of the arm and into the thumbs, and also a little bit to the pointer finger. We then look at C7. C7 also gets a little bit of the pointer finger, but it also gets the middle fingers as well. We go to C8. C8 does the last two digits, or the last two fingers, and also more the inside of the arm. T1 then gets, again, kind of more the inside of the upper arm, bicep area. After that, your thoracic vertebra, so T2 through T12, they're pretty simple. They just wrap around the spine or the chest in that specific area where that nerve comes out. So then we get down to L1. So what L1 does, that nerve then goes to the groin area. L2 goes a little bit lower, wraps around the hips, goes to the inside of the inner thigh. L3, you can start getting it more in the front of the thigh, and it crosses the inside of the knee. L4 goes a little bit further as well, so it's more, again, wrapping around the hip, going down the front of the thigh, middle of the knee, all the way down to the big toe. So if you're getting pain in your big toe, that's indicative of L4. We then look at L5, same thing. This one comes down again across the hip, but then stays more on the outside of the knee, goes to the top of the foot, almost all the rest of the toes. S1 then goes down more the backside and gets more of the heel and the outer side of the foot. And then S2, again, more of that backside and more of the inside of the ankle. So if you're getting pain patterns in, one of these sounds more familiar, like, hey, I get pain, again, shooting down into my big toe, well, that's how we know which spinal level we need to work on. So, yeah, very informative, kind of a great way to evaluate what you need and maybe what your specific issues are. So if there's anything that we can help with, if you have any questions about dermatomes, reach out to us. We're happy to help.